Community-acquired pneumonia, CAP for short, is the highest killer of the under 5s in Nigeria. I decided to talk to us so that we can together bring it under control. CAP is pneumonia acquired within the community or which develops within 48 hours of hospital admission. In acute pneumonia, the duration of the symptoms, that is, complaints, is less than 14 days. Acute pneumonia presents with the following: cough, fast and difficult breathing, and 2, fever. Diagnosis of pneumonia by doctors follow this path. 1, establishing that the breathing is fast and or difficult. 2, documenting abnormal signs in the chest through the use of a stethoscope. And 3, taking all this together with evidence of certain abnormal findings on chest radiograph. There are many risk factors for pneumonia, of which the major ones are: 1, household air pollution, in which the risk is very high at 1 out of every 2 cases. Number 2, moderately severe malnutrition. Number 3, low birth weight, that is, being born less than 2,500 grams. Non-exclusive breastfeeding during the first 6 months of life, lack of measles immunization within the first 12 months of life, overcrowding, that is more than 2 people sleeping in a room with 4 dimensions of 120 square feet. The 2 commonest causes of pneumonia are pneumococcus and H. influenza type B, and the main viral cause is respiratory syncytial virus, but estimates of their relative importance vary in different settings. In HIV-infected children, Pneumocystis jirovecti and Mycobacterium tuberculosis are important causes of pneumonia, although bacterial infection remains a major cause of pneumonia mortality in them. In neonates, gram-negative enteric organisms, particularly Klebsiella species and gram-positive organisms, mainly Pneumococcus, Ruby streptococcus, and Streptococcus aureus are causes of neonatal pneumonia. Whereas in school-age children, Mycoplasma pneumonia is an important cause of pneumonia. The Integrated Global Action Plan for the Prevention and Control of Pneumonia and Diarrhea, GAPPD for short, framework outlines key interventions to protect against, prevent, and treat pneumonia and diarrhea in children under 5. Adoption of the GAPPD by Nigeria, a lower middle income country, will reduce pneumonia mortality substantially. However, the GAPPD pneumonia score for Nigeria in 2017 was only 30%, which drastically falls short of the at least expected 84%. Common complications of pneumonia are heart failure and pus in the space surrounding the lungs. In a few severe cases that are not treated on time, respiratory failure may ensue with death. Management. This can be divided into specific treatments in which antibiotics are used according to the national guideline, and number 2, supportive treatments, which comprises gentle airway suctioning as needed, oxygen therapy via nasal pumps or nasal catheters, comprehensive oxygen system and pulse oximetry introduction, small frequent fields if tolerated, alternatively nasogastric tube, intravenous fluid about 3/4 of the maintenance if it not tolerated, and reducing eye fever. Counseling of mothers, caregivers, guardians are essential parts of the management of pneumonia. This includes right from the admission to the discharge. We tell the mothers, the caregivers or guardians the causes of pneumonia to be microorganisms. We also explain to them the predisposing environmental factors. Hand washing practices is emphasized, together with early recognition of fast bleeding, so that they can come to the hospital for treatment before terrible complications ensue. Immunization against childhood diseases will be emphasized. Also, exclusive breastfeeding will be encouraged. Caregivers will be expected to express fears and discussions so that adequate explanation can be given. And finally, avoiding self-medications, including cough mixtures.